So I try to explain to patients because they ask a lot of things like you're doing, with blepharitis, Demodex, MGD, is there anything I could do to minimize it? And so we're still getting the word out. I tell patients there was a time when we didn't brush our teeth normally, back in the day, and people will lose their teeth and they realize if we just kept them clean, we can keep most of our teeth in our 70s and 80s. So the same thing, if we want to try to preserve as much of our oil glands as possible, we've already kind of equated that the computer is there, but daily hygiene. Most things that you clean your face with are not approved to go on the eye. You look at the bottle. And so we need something that we can cleanse our eyes with daily, meaning our eyelid, the tissue around the eye. So I usually recommend either wipes, foams, or gels. It really just depends on the level of what their tear film looks like. So each one works a little bit differently. And then I usually recommend that they have a concentration of a cleansing agent that is safe for the eye. And so there's been some a little bit of backlash with tea tree oil and is it good or bad for the meibomian glands? But tea tree oil at super high concentrations, not regulated, yes. Low concentrations of tea tree oil that is regulated by an eye care provider is a little bit safer. So tea tree oil wipes, wipes that have hyaluronic acid or spray, HOL spray that's produced by the body, which is a natural antimicrobial, natural viral, antiviral. Those are things that you can use nightly after you take your makeup off or cleanse your face. Then you go behind and clean the lid and the eye margin or spray. And then usually I say, at least once or twice a week, a warm compress. So that's going to help try to keep the oils inside the glands comfortable. So usually wipes, gels, or foams, either they're going to be a slight concentration of tea tree oil. So usually a very low concentration. And I like ones that are infused with another natural oil like almond oil or coconut oil or castor oil. So infused with the oil and tea tree oil. And then, or you can have your HO spray. And so once again, I say those things, but people like to self-prescribe a lot. And so it's okay to do over-the-counter things, but you should still do those things under the care of an eye care provider. So have these conversations. Most of us we want to talk about it. So ask us if we're not already giving you the information. So that way you can, do properly hygiene that's going to be a long-term benefit for you versus something that, may be causing more issue than not.